Good morning, everybody. How are you? Hope everybody had a great evening and are hitting the ground running this morning. Let me see if I can get this to work. Okay. Yay, that worked. I don't need captions. Okay, so we're going to do this a little bit differently. So these are Dr. D'Amato's slides. Thank you, Gina, for contributing. But what we thought we'd do is kind of go back and forth in between the different topics. And obviously, if I say something and Dr. D'Amato's like, no, you're crazy, we're going to do it this way, she'll jump in and can also add to the discussion. And if you guys have a compelling question about whatever side effect we're talking about at that moment, feel free to raise your hands. And we want to try to keep this interactive so we're not just babbling for an hour, I think we have. So, all right, so this is us. And again, some of the things we're going to touch on, part of some, as you know, there's side effects that come from living with the disease, but then there's side effects from the treatment as well. And many of them are in common. So hopefully we'll touch on everybody's particular issues or some of the things that are most commonly coming up, but we'll obviously have time for stuff that's not in the PowerPoint if you guys have questions. Okay, so we thought we'd start with nausea, which is always one of these challenging but actually manageable side effects that's pretty common. So what causes nausea? Well, certainly the disease itself can cause nausea. Many other issues, which I'll talk about here in a second, can cause nausea. And then, of course, treatment can cause nausea. So some of the things you might not think about contributing to nausea include pain. So poorly controlled pain can actually give you nausea symptoms. And by nausea, I'm not just talking about like vomiting, right? We're talking about that queasy feeling, like just feeling your stomach's off, and certainly, impacting appetite. Anxiety, depression, those can also cause nausea. So important to keep in mind non-traditional medical contributors too. Constipation, dehydration, not eating particularly well or eating too much, heartburn or reflux. And it doesn't always necessarily have to be something you feel. So I have a lot of patients that might have acid kind of gurgling in their stomach that they actually don't feel it like you would if you ate like an extra large pizza or, overindulged in whatever trigger, chocolate, mint, alcohol. Those can all be common triggers, coffee sometimes as well. So sometimes we'll tell you, well, let's try to treat acid, even if you may not feel heartburn, because often it can make a huge difference. Motion sickness. Yes, that's true. That's funny. So I guess if you're in motion and don't realize.
Like texting and driving.
Oh, yeah.
People like texting and driving or something. I mean, that's a different conflict. But a lot of times people don't realize when they're reading their phones in the car that can cause that.
Very good point. So for those of you on the Zoom, we were just having a conversation about texting and driving or looking at your cell phone while you're in a car as potentially triggering nausea.
Personal experience.
Yeah. Infections for sure. Tumors. Yeah. So the gist itself, particularly I've seen this a lot in people that have peritoneal disease. So what that means is maybe you've got these little tiny nodules or you've got fluid inside the belly cavity that can actually trigger quite a bit of nausea simply because your bowel, which is normally supposed to contract and do the toothpaste tube thing where you squeeze one end and squeeze this in, it gets hung up. So fluid or nodules or disease can be very irritating and keep it from moving normally. And so that can often present as nausea. The scarier things that you want to think about are definitely making sure you're not obstructed, right? So an obstruction is when nothing's moving through, and certainly nausea that's followed by vomiting or where you're not able to get anything down is an emergency, and you definitely want to seek care out for that. So those are some of the causes. What about treatment? Well, we always will ask you many, many, many questions about when your nausea is coming on. Is it associated with triggers or particular causes that we've talked about? Is it from your medicine? Trying to stay hydrated is super, super important. So not having enough fluids is not good. And then treating these other things. So keeping your pain managed, look and smell your urine. I guess that's for infection.
Well, for hydration.
Yep.
So you want to, sorry.
Oh, there's a microphone.
So this will pick up
perfect.
too.
Okay, awesome.
There you go.
Okay, so you always want to be looking at your urine because your urine will tell you a lot. When you're dehydrated and you're not drinking enough, that can cause nausea. Also, if you're on pain medicines, you may have a hidden urinary tract infection. So you want to be looking at your urine. You want it to be clear, maybe very light yellow. If it's not, you need to drink your water. Okay. I always tell patients, if you're not annoyed by how many times that you have to go to the bathroom, you're not drinking enough water. Okay. Every hour on the hour. Okay. Our bladders only take so much. And then again, the hidden urinary tract infections, your urine could smell off. Now, after eating asparagus, that's a different story. But, you know, and actually, if you have asparagus, it's a good tool, because if you have your asparagus and later in the night, you're still smelling that asparagus urine, you need to drink more, because that should have been out of your system by now. So,
okay. No, yeah, so you can hang on to that and then we can just jump in. All right, so what can we do to try to treat nausea? So again, treating causes, we use a lot of different medications. Now, just like everything else under the sun, not every medicine is going to work for everyone. So there'll be a trial and error period. We like starting with a medicine called ondansetron or Zofran, just because it tends to work well, but many people may get constipated from it, or they may get headaches. So we have to experiment, particularly when you're starting out, to see what medicines might work best for you. There's a list of some of these here. The other example is like Reglan or metoclopramide. So if you're one of these people where your bowel is not really moving forward, maybe because there's tumor or fluid in the belly cavity, that's sort of a medicine that tries to make the bowel contract more. So that may actually be helpful. So that's basically the overview there. Additional tips. So actually take your nausea medications. You can always take more than you think. So even though the bottle may say twice a day, we often will talk to people about, well, how much you actually taking? Can we stack the medicine? So maybe you're taking Zofran twice a day and then squeezing in Compazine every 6 hours. So there's a lot of things we can do to help with that. Small meals. So we all think about, back in the day, being able to eat a big breakfast, lunch, and dinner. Well, many times for people that are nauseated, we have to adjust that a little bit. So I tell people to graze, have a snack always handy. If you were like, I kind of feel like I'm a little munchy, but not hungry, I'll just wait for lunch. No, we want you to actually take advantage of those times where your stomach feels settled and get those calories in. Definitely water as much as you need. And if you can't get water in, or you're still smelling asparagus and you haven't been able to get the fluids in that you need, we can certainly do IV hydration as well. So talking with your doctor about that. For your mouth rinse. So oftentimes the taste is sort of metallic, or you may just have the sour taste in your mouth, particularly on medications. Taking care of your mouth. So whether that's toothpaste and mouthwash, which can sometimes be a little extreme, you could also try basically a baking soda saltwater rinse, which is great, especially if you've got raw sores or you've got like any sort of irritation in the mouth, as well as the funny taste. Bland food. So everybody, again, is different. So keeping a diary of, wow, I ate oatmeal and that tasted really good, and that seemed to settle my stomach, or gosh, I had one of these insurers and it was too milky and it really, really did me for a loop. So keeping track of what works, what doesn't work, and then often working with a nutritionist can help come up with some creative ideas about other things that might fit your pattern. Eating dry food, so the brat diet we talk about, so bananas, rice, applesauce, toast, and similar foods is great for when you're not feeling well. And then as far as other medications, with all of these medicines, we'll counsel you if you're taking chemotherapies or other medications about which ones are okay, when you need to take them, how far away from food, and all of those sorts of things. And that includes reflex medicines. And then a lot of this was the same. All right, so I have to ask Gina about the sardines. Who on earth is craving sardines when you're nauseous? Second line, keep your pantry and freezer well stocked with foods, including snacks, tuna fish, sardines, peanut butter, soups, crackers, cheese, hard-boiled eggs. Do you have sardines in your freezer?
I'm Italian. So yeah.
Sardines, what can we do? Yeah, we do.
Okay.
Yeah. It's a good source of protein. They're like fish in a can, but I mean, yeah, probably not if you're that nauseated, but whatever.
Love it. I'm learning so much about Gina from like reading these slides right now.
But I don't know. Maybe it was highlighted because it was supposed to be deleted or something.
No. I highlighted it so I would like.
I might have fired the editor, which is me.
Go ahead.
Maybe saltines. It's probably saltines. It's probably salt. But it's next to tuna fish.
No, that's fair. That is fair.
I don't know. Try it on a day that you're not nauseated, and then maybe see. I don't know. I would probably avoid it on the day that you're nauseated.
That's awesome. All right. So eat a bedtime snack. So snacking in general and grazing is super important. Making every bite count by choosing protein-rich foods. Yes. So certainly quality over quantity, even if, it may not be the most traditionally low-calorie item is actually what we want. So making a milkshake where you throw in ice cream or Greek yogurt or making a smoothie, that's huge bang for your buck. And sometimes it's just easier to get a little bit of liquid or like a shake down as opposed to a solid meal. All right, so I'm gonna shift over and you have altered taste. So maybe do altered taste and then diarrhea. Okay.
Okay, yeah, the altered, I think I might have borrowed these slides from somebody else, maybe. So there's, you have different tastes in your mouth. So you always want to be looking at your tongue too. A lot of times patients will say that they don't taste well or they have pain. And I look at their tongue, they have like a white film on their tongue, and that could be thrush. So, and, people are susceptible to that. So you want to be looking at your tongue. But, certain foods you can, sometimes they're bland. So you have to test out different things, different spices. And you could, if you really have that odd taste in your mouth, you can use like a homemade mouthwash rinse. Okay, so diarrhea. Okay, so basically, we're talking about the GI issues first because it is called a GIST tumor. So of course we're going to have GI issues. So diarrhea causes certain foods, medications, the tumor or previous surgeries. We've had some patients that have had intestinal surgeries. So, your small intestine absorbs fluid, and so does your colon absorbs the fluid. So if it doesn't absorb any fluid, then you can get diarrhea. And of course, infections can cause it as well. So you want to keep a food diary. So what's a food diary? A food diary is that you really have to kind of do it at least for a month. It's ideal to do it for a month. And you write down everything that you eat and how you feel. Okay, so you ate this, you feel good. You ate this, you had diarrhea. You ate this, you got constipated. And now you have to have it for at least a month, because you can't just say, oh, well, I had sardines and then I had diarrhea and then you're never having sardines again. Well, that's okay. But like, say if it's chocolate or something, and then you're like, oh, I had chocolate one time. And then all of a sudden now you say, oh, I'm never allowed to have chocolate again. So you have to make sure it's a pattern, and that will be really helpful. And then you can decide, okay, this one food gets you some diarrhea. Well, you can decide, but I really like this, I can do it. Well, then you can be prepared. Right? You can come with your pills beforehand and say, I'm going to eat this, but I know it's going to cause trouble. So let me do some preventative stuff. Or you can say, you know what, it's not worth it. I'm just going to avoid it. Okay. And then there's medications. We have 4 layers. We have 4 degrees of medications. We have over-the-counter Imodium. Now, if you buy over-the-counter Imodium or loperamide, right, it says, oh, don't take for more than 2 days in a row and call your doctor, and you're only allowed to have 3 pills. Well, that's because we don't want people that don't have cancer or don't have a reason why they have diarrhea to be treating themselves, right? We want them to go to the doctor, but you've been prescribed this. So we can give it to you, and when there's a known cause for the diarrhea, so then you can take it, and you can take 2 pills after each loose stool. So 2 pills after each loose stool, up to 16 pills a day. Now, if you're taking more than probably 6 pills a day, probably the Imodium's not going to cut it. And then we can go further up to Lamodal, which is a prescription. And then you do the same thing, 2 pills after each loose stool. And then we have tincture of opium. We have Octreotide, which is a liquid. And then we have octreotide. So things that we think are unacceptable. If you have a couple of loose stools and it's not affecting your quality of life, then it's fine. But if you're having more than 3 or 4, then you could potentially get dehydrated, right? And you may not be absorbing foods, so that's not good. Or if you're having any accidents, we don't want people having accidents, like you're on your way to the bathroom and you don't make it, or you're just sitting there and it's like, I didn't even know it was coming. That's not good, right? That's not good for your quality of life. People wind up staying home because they feel like, oh, I don't want to go to this event because I'm going to be, crapping in my pants. So I don't want to go. And so those are things that are unacceptable. And you can talk to your doctor about it. And there's medications we can definitely avoid that. So that's our goal for you guys. And so having the food diary coping. So some of the things that can cause diarrhea are high fat and spicy foods, low fiber bland foods. But again, choose low fiber bland foods. But again, everything is different for everybody. Sip on broth, tomato juice, electrolytes. You can add the brat diet, the bananas, applesauce, oats, and limit the lactose and sorbitol. So like the sweet and low, that can cause it. And then limit hot or caffeinated beverages. But, again, everything in moderation, right? How I'm like, where's the coffee? And then I'm telling you to avoid coffee, but you have to know what things work. And then the opposite.
One other thing.
Oh yeah.
So I had a patient not too long ago that actually had a duodenal cyst and wound up having a big surgery to where part of the pancreas was removed. And so, you don't have to necessarily have had surgery in your pancreas, but we've had several patients where supplementing with pancreas enzymes, which basically replaces some of the digestive stuff that your pancreas normally spits out, can be quite helpful. So for people that have had issues with, that are clearly losing weight or their blood proteins are low, we've tried that and actually has been fairly helpful for some patients. So just another random thing.
Yeah. And also infections. So, some patients are on their Sutent or they're on their Gleevec and they have their normal diarrhea. And then all of a sudden they have, abnormal, and they're just thinking, oh, it's their medicine. Oh, this is okay. This is medicine. They wind up having C. diff infection and they don't realize it. So if there's something off, we would sample that, and you can have a hidden infection that you don't know, and you're blaming it on your cancer or your medicine. And then constipation, so the opposite. So we have everybody, it's like you got two extremes. You got the diarrhea, you got the constipation. So what causes constipation? Dehydration, certain foods, medications, and the tumor itself, that you have again in your GI tract, you have your stomach and your intestines. So if you have tumors there, it's a big hose, so it's going to block it. So you could block the flow. So how do you treat hydration? If you're dehydrated, it's very hard to have a bowel movement. Okay, so water is key. And again, as we said previously, if you just can't get that much fluid in, you can ask your doctor for IV fluids. I mean, now they're popping up everywhere. People are not sick getting IV fluids, Vegas and all kinds of places. So it can help you. And at least it could kind of start you to be hydrated, and then you can get hydrated after that. You don't always have to be on IV hydration. Fruits and vegetables. You have to eat your fruits and vegetables. Okay, you're supposed to have 3 to 4 servings of fruit every day and 3 to 4 servings of vegetables every day. So it's a lot of vegetables. So you want to try to have a vegetable with each meal. Now, some people don't like their vegetables, so you can hide the vegetables. Okay, you can hide it in smoothies. Throw some spinach and kale in a smoothie with some other fruit, and you don't even taste the spinach or the kale. Also, if you put like olive oil and salt, that like sauteed spinach with some olive oil and salt, that's good. And of course, cheese makes everything taste better, personally. But and then stool softeners. Okay, we can use stool softeners. So the over-the-counter stool softeners of the DocuSate is usually 100 milligrams, but the prescription is 250 or 240. So if you go to the store and you try to get the 240 or the 250 ones, or otherwise you got to take 3 of the 100s, which is fine, but it's usually not enough, the over-the-counter. Miralax. So you can take Miralax every day. Usually if someone has chronic constipation from pain, we usually do stool softener plus Miralax every day, and then a laxative if there's no bowel movement every other day, just to prevent, because you're too constipated, then you can get hemorrhoids. Yes. Mm-hmm. Okay, so when you drink regular water, just like without anything in it, and you drink water, you shouldn't be retaining fluid. Like when you retain fluid, that's your body saying that I'm dehydrated and it's trying to keep the salt in. So it may be that you have to limit your salt intake so that the water, so you don't accumulate the fluid doesn't accumulate in the legs. Now, if we give you IV fluid with normal saline, yes, that could retain the fluid, but it's a delicate balance. It definitely is. So I don't know if you have any other suggestions. I won't have to see everything.
Yeah, it's a little tricky, but you're right. So when people get swollen or retain water, it's actually a salt problem. Either there's too much salt in your body or not enough salt, or the balance is off. So and most of the time, even though it feels like you're all swollen, we want you to drink more water so that you kind of flush out some of those electrolytes. But
yeah, we'd have to look at your labs too to see where your like kidney function is. If you're, sometimes you could be dry and not fully dehydrated. We look at certain labs, the BUN and the creatinine, to be able to tell. And we would have, sounds like you have like an electrolyte thing, an imbalance that could be fixed potentially, but definitely talk to your doctor about it. Some of the, sorry. Okay. So the pro and the pre and those it can change your gut flora. Okay. So it can change, you have normal bacteria that's in there that helps digest food, and there's like a very delicate balance. So taking the probiotics can interfere with that. And the issue is that it hasn't really been well studied in cancer. So we don't know the interactions with the medicines that you're on, if it's metabolized in the liver. Recently, we had a researcher from MD Anderson give us a grand rounds talk about the gut flora, and we're learning more and more about it and how it can control how you respond to treatment. And there was one study, it was with chemotherapy, but it seemed that patients that were taking the probiotics actually had worse outcomes, like as far as their response to treatment. So I would avoid the probiotics. If you're really having bad GI issues, and it's not being controlled with these medicines by your regular oncologist, they can send you to either the GI doctor or the dietitian. But I would try to avoid the probiotics. I don't know if you feel more strongly or.
There's some people swear by them, right? So I've definitely had patients that are like, as long as I'm taking my probiotic, my prebiotic, I feel great. Most of them are actually destroyed before they even get through your stomach. And that's sort of like one of the weird things, is that the way they're formulated, the acid in your stomach is just going to toss all the bacteria. So how it actually would make a difference is sort of unclear and questionable. And now you've forked out a ton of money for these bacteria that may or may not be doing anything. We do have a fair number of patients that feel well on yogurt as well, which is not, it doesn't have like all the species and that sort of thing, but at least it's something. I have people that swear kombucha changed their life and fixed everything. So if you can stomach the stuff, which I cannot, then, go for it. But again, this is all stuff that goes in your food diary, right? So like if you're going to try some of these things, or you have a particular blend of probiotic and you are going to look at it, we have to make sure that, that we're watching what happens, and definitely sharing that with your doctor. So in case you suddenly have some new weird thing, like your side effects get much, much worse from Gleevec or whatever, that we can tease that out. Mm-hmm. But like if you just have yogurt daily or fever, I'm assuming that would be half food in that setting.
Yeah, I'm talking pills. I think it's better personally to just get the food, right? So you have all the, everyone wants to give you these nutritional supplements, and you could get all your nutrients that you need from food. The only nutrients that you may not be able to get enough of from food, if you have weak, like you're menopausal, postmenopausal, and you have weak bones, you can't get enough calcium and vitamin C from regular food. So you want to take supplements of that. But other than that, you really don't need to take any nutritional supplements if you have a well-balanced diet and you eat your fruits and vegetables. So yeah, so you get the gut flora from yogurts and kefir and kombucha, which, I mean, I don't like either, but but some people do, but and I like sardines. So clearly I like everything, but yeah, but my friends swear by it. Yeah. And I guess they put some things tasty, but okay. So senna and enema, we try to have people avoid enemas, but sometimes we just have to. So coping with constipation again. So this is like, if you have, and again, you kind of want to keep kind of a regimen. See, like there's certain foods that cause constipation that you may or may not be aware of. Meats, they say avoid red meats. I would say it does. Like I love steak and I love my red meats, but if I have it, I'm not going to the bathroom. So, and if I don't have my spinach, I'm not going to the bathroom. Like you got to know your body and know. So if you're going to have steak, you better have a lot of spinach with it, or just say, I'm going to take my stool softener because I'm going to have my steak, or just say, I'm not going to have it. Drink plenty of fluids. So how much fluids should you be taking? So it's about half your weight to 2/3 of your weight, body weight in ounces. So if you weigh 150 pounds, you want to be drinking 75 ounces, which, those, yeah. And that's if you're just like kind of a sedentary, that's what I'm saying. And then 75 ounces, you're going to the bathroom those times. So, and we kind of put everybody, we treat everybody the same, right? We love everybody, but we treat a 100-pound person the same as a 300-pound person. Like you need to drink 2 liters of water. Well, a 300-pound person needs to drink much more water than a 100-pound person. So you really have to, figure out how much you need to drink, and keep a bottle. Don't just say, oh yeah, I'm always drinking, and I have these little water bottles and they're all over the place. You really want to get a nice bottle. So that's a liter, right? Is that a liter? 700 cc. 33.8 ounces. 33. Oh, that's a confusing one. I like the little. Okay. It's too early in the morning to do math. Okay, that's a liter. Okay, so 3 liters if you're 150 pounds. Okay, so you got to drink your water. Now, if you wait, and like if you're kind of the wait to last minute thing, and like you're like, oh, I had one, and then it's like 4 o'clock. Oh, I got to get my other 2 in. Then you're up all night going to the bathroom. So you got to start early in the morning. Try to at least get a liter in before noon, even 1 or 2 o'clock, and then try to finish up your water by 4 or 5 o'clock. Otherwise, you're up all night. Okay. Also, you want to make sure you're having enough fiber, but not too much fiber. So it's a delicate balance. Other things that can help, prune juice and things, but water is key.
Contrary to popular belief, Metamucil is usually a bad thing. So I've had people dump a bunch of Metamucil in all of a sudden, and oh my. So that basically bulks quickly the stool, which is not necessarily what you want. So you watch TV commercials, and yes, for the average person with constipation, you get more fiber, more bulk, and that's great. But for people that have a more complicated situation, Metamucil is usually bad. So be careful. Okay. So it might be worth trying with diarrhea, because then at least you have something, but it could also, just depending on how your body handles it. So.
Okay. I don't know. I'll just keep. Okay. All right. Or do you want this one? Okay. Any more GI? Anyone have any GI questions before we move on to leg swelling and edema?
So you said fiber, avoid too much fiber. If natural fiber is also bad.
No, so you have fibers in foods, so fruits and vegetables. So it's just a delicate balance. And also, especially if you've had any kind of colon surgery, it's a delicate balance. So that's where the food diary comes in, because there are going to be certain foods that are going to be helpful to you and not. But so it's, if you have too much, you get constipation, if you don't, or diarrhea, and back and forth. So, but most cancer centers have dietitians that can help you. So there's a registered, I just learned this last weekend at Sarcoma Alliance meeting, but so there's a registered dietitian. They are the people that work at the hospital that can work with cancer patients. Then you have like nutritionists. Nutritionists are not like registered dietitians. So there's like nutritionists, anyone could be a nutritionist. So yeah, and so you want to make sure you go to the dietitian that's at the hospital, because otherwise you go to like a random nutritionist and they don't really have the medical background, and they're giving you probiotics and stuff like that. Okay, we're gonna move on to swelling. Well, here we go. Okay, you want it? Okay, you can go ahead.
Okay.
Do you know what that little thing is? Have you ever seen that?
There's a grabber.
Yeah. Well, we'll go over it. Okay.
You can explain that too. All right. So we'll move to swelling and edema. So as many of you know, you can get swelling in various places in your body. So this can include your legs and your ankles and your feet swelling. This could include your whole body swelling up. So you're kind of feeling like the Michelin Man, the big bubble guy. And then particularly with imatinib and drugs like avapritinib is another really gnarly one. You get a lot of swelling around your eyes, right? So facial swelling and around the eyes. So, and then there's belly swelling that's isolated that can be from the liver. That's called ascites, or basically we've had some patients, particularly with advanced GIST, where we might have to actually drain the fluid because it's trapped in the belly cavity. They put a little needle in and can drain that fluid off. So fluid could be everywhere. There are some other causes apart from those sorts of things that we want to rule out. So if one of your legs is swollen and the other leg is not swollen, what might you be worried about? Blood clots. Yes. So we will ultrasound you at very, very often. And if we even are not sure if one leg is bigger than the other, we'll still probably have you get the ultrasound, because when you have cancer or when you're on treatment, chemotherapies, your risk of blood clots is so high, because the body is sticky. The blood, the factors in the blood make your blood stickier than usual. So you're more likely to clot. Nutrition. So there's a magic protein that is on some of your lab work called albumin. There's also protein, which is confusing, but the albumin is the level that reflects your nutrition status to some degree. And albumin is a very powerful magnet, if you will, for water to go into your bloodstream. Okay. So if you think back to chemistry, there's a pull that keeps the water from being out in your tissue to being in your blood vessels. So it actually goes to your kidneys. It goes where it needs to go. So if your albumin is low, that fluid doesn't have that same pull to go into the bloodstream. So you wind up getting fluid in the wrong place. Does that make sense? So often if you're not eating particularly well, or you're just as advanced, or you've just come through surgery, or you've lost a bunch of weight, your albumin can be all wacky, and that can contribute to some of that swelling as well. Difficult to treat, but that's partially why nutrition is so important. And it doesn't happen overnight. It's something we have to work on to build that back up. Heart and kidneys. So if your heart has issues, that's sort of a classic thing that people think of for swelling. Usually not the case for most of our GIST patients. There's usually other causes, but always important to keep in mind. Or if for some reason you're having kidney problems, if your kidneys are blocked or obstructed, that could certainly be an issue. All right, so what do we do? So water pills can help, but often they don't work really great when you've got the wrong space type of fluid. The diuretics work by draining water out of your bloodstream. So if the problem is not that you just have too much water or too much salt plus water in the body, these often will just make you dehydrated and not necessarily pull the fluid in, particularly if you are in that low blood protein situation. So we try them, but we're careful. As we were talking about earlier, it's often a salt problem, not a water problem per se. And so any of you who have eaten New Orleans cuisine may notice that, wow, my legs are really swollen this morning, or my face looks all puffy. Salt holds water in your body. So if you can avoid some of the super salty stuff, you may find that to be helpful. Water, water, water. My husband always jokes. He's like, the answer to everything to you doctors is water. And that's actually true. So when in doubt, just drink more water. Elevation. So anything that's swollen, if you can put it up against gravity, it'll help drain and make you more comfortable. Compression stockings. So those things are evil, but they work. If you can get them on, get a friend, a buddy that you trust to help you put those things on, but they will help squeeze your legs and get that fluid back into your body. I don't know what this contraption is.
So this contraption is called a like, I forget exactly how to Google it, but it's and I don't know the exact name of it, but it's a compression stocking hanger. And so, you know, it's when you're really swelling in your belly and your legs, it's hard to get the compression stockings on. So then you have to like ask your loved one, who no longer becomes your loved one because they're so annoyed because it takes like 20 minutes to get the compression stockings on. It's really bad. And so this thing you can buy over on the internet for like $35, maybe I think actually $20 or $25. And you put the compression stocking over it, and then you just step right into it, and then you pull it up. And so it's really easy. It saved like a couple of marriages, I think. Yeah. Stockade. That's what it is. Yeah.
Stock assist.
Yeah. Stock assist. Yeah.
That's awesome.
Yeah.
I did not know that.
I know.
Okay. Lymphedema clinic. So this can also be helpful for people that sort of have chronic swelling, or maybe for other reasons. So this is a group of part of physical therapy that does a lot of massage. They'll do wraps, which is sort of like compression stockings kicked up a notch, but that's their job. So they will wrap you to no end. So not right for everybody, but again, if your problem is a drainage because of the lymph system. So let me back up a second. So you have the blood vessels that carry the blood out from your heart and then back to your heart. But then you also have the lymph system, which is designed to drain that fluid in the space, which is the extra fluid I was talking about. So for example, some people, depending on where your gist is, if you've had a bunch of lymph nodes removed for some reason, which is not super common. I'm trying to think of a good time where you'd see lymphedema necessarily, but for other types of sarcoma, let's say in the groin or in the pelvis, and we pull out a bunch of the lymph nodes, which are the glands, that's where all that fluid passes through. And so you kind of disrupt that highway and it can cause fluid to build up. So again, it's another problem. Avoiding very hot showers. Yes, heat causes more fluid to swell. So keeping an eye on that. And then this is my patients. I have a couple of patients who are very conscious about the eye swelling. And so you actually can use preparation H on your eyes. I think it works variably well for others. I actually have one of my colleagues in the sarcoma community uses it when he doesn't sleep at night, Brian Van Tyne. Yes, this is true. He actually is very fond of preparation H to help boost your eyes as well. So try it and see. Go ahead. Yeah, don't get it in your eye. Go ahead. Oh, man. I'll summarize. Yeah. So yeah. Oh my goodness. Yeah. So the question is, we were talking about a patient who got what we call anasarca, which is like that whole body Michelin man swelling where the fluid is everywhere, and what could be causing that and what we could have done. So that seems extreme. That's not typically what we expect to see. certainly if they were on medication, stopping the medication and taking a break. And I've been able to manage with dose reduction too. So even though we say, oh, you have to take 400 milligrams of imatinib every day, it's actually a really good drug. And we've been able to get by. I have a patient who had an incredible response with 100, so 25% of that dose. So if we're in a situation like that, certainly working with the drugs if that's the problem. What were you gonna say?
That sounds like other medical problems that we talked about. It could have been something with her heart or the kidneys. There could have been a clot. She probably could have had clots in her inferior vena cava or something that was leading to her retaining so much fluid. And so that seems a little bit, we would have to like look at everything and probably see it wouldn't be a quick fix for that. But that sounds like a major underlying problem that needed to be explored.
Also, when people are unfortunately close to the end, it sounds like maybe that GIST was not the problem and that was something else. But when GIST does get very advanced, unfortunately, with that blood protein dropping, we will see more swelling as people get sicker. So. Swelling in the joints. Yes. So many drugs can cause pain or swelling, stiffness in the joints, sort of what we call arthralgias or arthritis. That can be tricky to treat. Unfortunately, it's the same thing as, some of these other these fluid shifts that are problems. We certainly try the typical arthritis remedies. So again, like icing, swollen joints. We try like exercise is really good because it helps to try to push some of that fluid out. Elevation if you need to. It's often not the traditional inflammation like what you have in other types of arthritis. So Advil or ibuprofen and Aleve and those sorts of medicines may not actually work that great, but we try that too. The arthralgias are unfortunately a problem. And if you're prone to those, they can be tricky to manage. I don't know if you have other tips for.
We would want to, just make sure it wasn't the typical arthritis, and we would do some lab tests, make sure you didn't have like rheumatoid or something like that. And then icing the joints could be helpful, and pain medicines, I think. Sometimes over-the-counter glucosamine chondroitin. I don't know how much that's a real drug or a placebo, but it doesn't have any interactions that can help sometimes.
I thought I saw another question. All right, so we have about 15 minutes left. I'm wondering, because we have like a bunch of slides for a lot of different things, but I'm wondering if we shouldn't just like open it up and kind of allow for the random questions. Okay, go ahead.
I take now 300 milligrams of Gleevec, and I have such severe muscle cramps at night that, it just distorts my legs, and I haven't slept. Sorry.
Oh.
And I keep Tums by the bed. I keep tonic water by the bed. I can't seem to get it under control. So do you have any other remedies or suggestions? I'm sorry about that.
So, the leg cramps are a tough one. It's usually some sort of electrolyte problem. There could be some certain foods like salty foods or could be triggering some of these things, or not enough electrolytes could be triggering them. We could try some muscle relaxers. That could help you. The muscle relaxers, but they kind of can knock you out. So if it's during the day, that's not going to be helpful. I've had patients say pickle juice. I've had people more like electrolytes. I don't know if you have any.
Yeah. So I have this patient who found some magic supplement thing on Amazon. It's got a weird name, so I can never remember it off the top of my head. So when I get back home, I'll look it up. But this guy has sworn by this electrolyte supplement. It's kind of like a Pedialyte thing. I don't think so. Which one? Hydrogen. Mm-hmm.
That actually works by it works by a different mechanism other than the electrolytes. But hydrant doesn't have all the sugar added to it. You have to be careful with some of the substitute, the other things that have a lot of sugar to them. But that saved me, and I was right where you were. And I tried the muscle relaxers, and it didn't work. And it has allowed me to kind of get my life back.
I've had that issue with foot cramps for like a year and a half. And it got so bad. It was awful. I couldn't work out. I couldn't do anything. And that you may have already done this with your doctor, and I have amazing doctors, but oncologists, right? We're not talking about, so I would talk about my foot cramps and they try to think of things, and it was my sodium. I ended up in the ER and my sodium was really low. And so I don't know, I guess that's just something now that we monitor all the time. And I look at everything. I wasn't always diligent about that because it just wasn't my concern, but I notice if my sodium starts getting low, I start getting more cramps, and it's a totally different kind of cramp than a dehydration cramp. It's like so much more painful. I couldn't even describe it. It was awful. So I'm sorry that happens to you. I'm hoping it's like an electrolyte thing, but I didn't look at that with my doctor, and now we do. And that's helped immensely, along with some of these other things that I take, but that's just something I have to keep an eye on.
Potassium, mag, and sodium are your big electrolytes for muscle cramping. So yes, if you're not getting labs or you haven't been checked, I'm presuming that that's normal. For most people with cramps, they're normal. The other magic bullet that it was saved somebody incredibly, so was iron deficiency. So if you are low in iron, you can get crazy leg cramps, and unless they're specifically checking your iron stores, you don't have to be anemic or you don't have to be super anemic, but if you're low in iron, that you can fix that, and it's magical. So yeah, always a check. Sorry, mustard? That's a new one. But this is the stuff, so we don't, for oncologists, we have no idea. So getting that stuff out there, or these random supplements that maybe you found that help for you, share that with your folks. Go ahead.
Okay, for those of you who get cramps often. Okay, thank you. For those of you who get cramps often, we're talking about things that might prevent it. But when you get the cramp, what I use is Highland's Leg Cramp Cream. And it works so fast. It's just amazing. HYLAND'(S), Leg Cramp Cream. I get it through Amazon, and it's a little bit cheaper there. Yes, HYLAND'(S), Highland's Leg Cramp Cream. So I apply it at the first sign of any cramping, and I rub it in for maybe a minute. And when that's done, one of the magic, you're going to think this is crazy. One of the magic ways of getting rid of my cramps is to get myself up and go to the bathroom. And once you're sitting on that toilet, your brain goes, oh, I've got something else here I have to worry about. Goodbye.
A lot of this stuff, of course, is anecdotal, but I think it's important to understand the difference between what I call old age cramps, a lot of dehydration, and medication, Gleevec cramps. And they're different. As you know, I have had a lot of cramps, cost me my career. There's a lot of different methodologies out there that are anecdotal. But if something works, it works. And I went many years, I've tried almost everything. And the first thing that actually helped me was acupuncture. Having said that, when I went to another city and saw an acupuncturist, it made things worse. So somebody has to be really good at it. And I'm into pickle juice now. The problem is when my hands are cramping, I got to scream to my wife to open the pickle juice for me. But almost invariably, within a couple of minutes, it's made a significant difference. And like a lot of you, I get a lot of serious cramps. So I think understanding the difference is kind of important. The other thing that I'll comment on that you said, people that get swelling, and many of you know I've been at this for 25 years, and people don't seem to see swelling in my eyes. For a long time, I took Tylenol PM to sleep. And then I realized it really wasn't the Tylenol that was making a difference, but the Benadryl. And I'm sort of addicted to Benadryl, which does help me when I do get up in the middle of the night and then fall back asleep, but I also don't have swelling in my eyes. And I always wondered if there was a correlation there.
Could be certainly some sort of like an allergic component. Is a steroid, right?
Steroid, you know, anti-inflammatory steroid or allergy. So probably
They say that, you know, Benadryl.
I don't know if you have a Benadryl for a period of time.
Yeah, Benadryl is fine. I mean, you can take if Benadryl, Atarax is the other one. We use that a lot for people that can't sleep or if you have insomnia, just because your body doesn't get addicted to it, like it did, like Ambien and sort of some of the other ones. Your body develops a dependence, but Benadryl in theory shouldn't.
One of my docs wanted me to do a sleep study, and I did.
What else? Whoop.
So what I do is usually when the cramps are light, I stand up and drink water, just wait for say 2 minutes or so, just stand and like maybe hold on to the wall for support, that helps. But the ones I get at night, those are severe. Like, you know, I feel like I'm okay with the first one, but then the other leg also starts cramping. And recently my doctor suggested TerraWorks. It's a spray. You can actually put that spray on before you go to bed or when you get it. And then 5 minutes, you're all right. And you don't get the pain for the rest of the night. If I don't do that, I'm just cramping every say 2 hours. And normally I don't get sleep also. The melatonin and Benadryl doesn't work for me. So this is another way, like, you know, for like at least to get rid of the cramps, so maybe you sleep better.
Yeah. So I had a hard time hearing all the details too. Can you let us know again the name of the spray that you guys are, because other people are talking about it too.
THERAWORX.
TheraWorks. THERAWORKS. Is that right? Works. WORX. TheraWorks. For cramping muscle, it's a spray for muscle cramping. Yeah. Okay. Yes. Anxiety is definitely a huge component of all of this. So we talked a little bit about this in the women's session yesterday too. So one of the major things with all of this is there's a tremendous uncertainty, right? And living with cancer, living on treatment means that you're sort of on this perpetual roller coaster, right? And that causes anxiety. And there's many different causes or contributors that for your own individual state. So we certainly do a lot of talking with our patients in clinic, but we're not professionals, right? And it's something that you need time. So we always recommend trying to get you set up with either a therapist or a counselor. Sometimes if the anxiety is disrupting your life to where the function is more of a problem, even medications can help. And we'll start some of that, but I'm not a psychiatrist, and there's new medications out there with better side effect profiles that I may not even know about. So always getting you guys to the experts is super important. I don't know if you have other.
Last year I was on Student and I had a lot of side effects, and I ended up asking my oncologist if I could see a palliative care doctor.
Mm-hmm.
And I had a couple of Zoom sessions with her, and she always had a guy with her who was a social worker. And I got so much benefit from talking to them, working through some of the side effects. But I think just the anxiety, like she was saying, just being able to talk to somebody who could really help guide you and listen. And, it's a palliative care doctor isn't just for someone who's who's in hospice. They're there to help you manage your symptoms.
Mm-hmm. Nothing. We never argue with vitamins. Vitamins are good, but I haven't seen. I didn't see that for specifically for anxiety. Good.
So other issues about the sorry.
I think you know, some mental health. We have fatigue is a big one. I guess we don't have to. Fatigue is a big one, and you want to make sure that you're getting enough sleep. All right, so you got to get the other issues under control to get the sleep, and then also exercise is really important. Fatigue, also pain. There's a lot of different causes of fatigue. There's pain, dehydration, anxiety, and mental health is really important because you can have your normal feelings, okay? Of course, you're going to feel happy and sad and anxious. Every time you get a scan, you're going to get scanxiety, right? It's a real thing. We're trying to get it on the dictionary, Webster's dictionary. We're seeing. Anyways, and there's issue. What you can do is that you can have your normal, but if your anxiety is interfering or depression is interfering with your eating, your drinking, your sleeping, your relationships, or your daily activities, that's when you need to seek help. And we talked about that yesterday at the women's session. Again, dehydration can cause fatigue. And then, we did have, and sometimes you just are going to be fatigued. You have the gist and you're on medications. And so you have to prioritize your activities. So if you have more energy in the morning and you need to get things done, then you do those activities in the morning so you can rest later. So you may not be able to get everything done that you can do, and you can prioritize your activities. And then energy concert. Yeah. Sorry.
I had a question about how do you think about, you said exercise a couple of times for a couple of different things. How do you balance that with these other symptoms? I'm feeling fatigue, I'm feeling joint pain. Do I push through it because I know exercise is good, or do I listen to my body and say I shouldn't exercise? How do you manage those conflicting things?
So you always want to be listening to your body. Okay. So, and that's really important. But if you're on the couch and you're watching TV, and you're tired, you're not going to want to exercise, right? So, but if you force yourself, and you do want to force yourself to get up, let me just go take a walk down the street, okay? And if you're walking down the street and you're not huffing and puffing and you're not in pain, then you're probably okay, okay? So then you can push yourself a little bit more. If you're in severe pain or huffing and puffing and your heart rate, and you feel like your heart's pounding out of your chest, then it's a problem. And then you need to talk to your doctor about that. And then they can potentially do physical therapy if you haven't exercised at all and you're having those things. They would put you in physical therapy, which is basically like your insurance pays for a free personal trainer. But if you're not experiencing that, then you can put yourself on a regular exercise program, which could just be walking outside. If you haven't done anything, 5 minutes for 1 week, then 10 minutes for 1 week, then 15 minutes for 1 week, and slowly go up. And just to exercise, even a walking, if it's bad outside, if the weather is bad, you can go to the mall. Just don't bring your wallet, because then it'll be a problem. But have showed yoga has improved with cancer as well. So there are some, we don't have a lot of studies about diet and exercise with cancer, but yoga can be helpful.
Great. Thank you. Thank you. Let's give him a round of applause.